All right, so I want to go over several services that Titus Regional Medical Center offers treating different conditions of the urinary tract. One of the most common conditions that affects men is an enlarged prostate, otherwise known as BPH. It's a condition where the men have difficulty with urination. I wanted to make sure that everybody understood that the technology that's offered here at Titus, there's very few centers in Texas that have it, much less the country. And Titus has invested not only money, but also in personnel, equipment, and so forth, to bring this technology to our community. So I wanted to share this with you. So this is kind of the overview of the talk. We're going to talk about BPH, stones, and bladder cancer. First up, BPH. The treatments I'm going to focus on are the holmium laser enucleation of the prostate, which stands for HoLEP, and the UroLift. Okay? Okay. So what is the prostate? Well, the prostate's a walnut-sized gland that sits at the base of the male bladder. It surrounds the urethra, and it produces fluid that transports sperm during ejaculation. The prostate grows over time such that it grows in early age at puberty, and then it also enlarges at the age of 50 and continues to grow and grow and grow. There are several conditions I'm sure most of you have heard of or experienced. One is prostatitis, which is an infection or inflammation of the prostate. Another one is prostate cancer. And the final one, which I'm really going to focus on, is basically just an enlarged prostate. You know, it's important that, to understand each condition affects the prostate differently, and having one condition doesn't mean you have the other. The BPH is an epidemic in the country. If you look at it, nearly 40 million men each year are affected in the United States. By age 60, 70% of men have an enlarged prostate. And, if you live long enough, you're just going to get the condition. What is it? BPH is the clinical term for an enlarged prostate. And it's important to understand that it's not cancer. BPH is benign prostate enlargement and is not cancer. This slide shows on the left-hand side what a normal bladder and prostate look like, and on the right-hand side, what happens when the prostate enlarges. The prostate's like a vise around the urethra, and the bladder's a muscle. The function of the bladder is to store urine and to empty it. So you can imagine if see the little green pointer here. Here's the prostate. As the prostate enlarges, it obstructs this flow of urine from the bladder out. And when it does that, the bladder does what any muscle does, is when the bladder muscle works harder, it also gets thicker. But the problem with having a thick bladder muscle is it's not like working out your bicep, which makes your muscle more coordinated and stronger. It actually, since this is smooth muscle, it makes the muscle a lot more irritable. So people get symptoms of urgency and frequency and getting up at night, and also a slow urine stream. Okay, so the ultimate question is, so what? Why do I need to know about this? Well, when you get to your bladder at this phase, we can't reverse that. And your prostate's enlarged, you get bladder dysfunction, and then ultimately what happens is you can't pee, all right? Everybody has heard about this Foley catheter, okay? If you can't pee, you got a tube that's going in your urethra, and no one likes to have that, all right? So the idea is we want to treat this before you have the problem of not being able to urinate, all right? And that's a very common issue. The other problem is that, and this happens, I would say I see this about, once a quarter, is that if someone can't urinate, they may not even be aware of it, that there's a problem. The urine backs up into the kidneys and it causes kidney damage. Okay, that's what we want to avoid. So how does this occur? Well, the prostate over time will grow, and as it grows, it obstructs the urethra. So you can see here here's a normal looking prostate when you look in with a scope, and then as time goes on and the prostate enlarges, it actually can completely obstruct this urethra, which is a problem. So how do we recognize the symptoms of BPH? You know, how do we treat this condition? Well, these questions on here that look at the symptoms of, you know, frequency and urgency, that's on a questionnaire that I gave you, and that's what Seth asked you to fill out at the beginning. So if you look at your score, if you can add all those points up, the scale goes from 0 to 35. You know, generally, if you have symptoms over, you know, moderate symptoms between 8 and 19, and severe 20 and above, okay? The other thing we ask is, you know, how does these urinary symptoms affect your quality of life? Okay, so, you know, everybody's had the issue of, you know, if you have difficulty with urinating, you get up at night, you know, during the day you're too tired. You know, if you go to a movie and you go to the bathroom and you're there and you see 3 or 4 high school students go in and out of the bathroom while you're urinating, you also may have a problem, okay? You know, finally, you know, if you're a guy that likes to play golf and you spend a lot of time finding where the bushes are, you may have a problem. You know, this is common. You're on a plane flight, you're getting up 3 or 4 times during a, you know, 2 or 3 hour plane flight, or you're at the movie theater and you can't sit through the whole thing. You know, these are all signs that, you know, you probably need to do something about it. And then, of course, you don't want to be one of these guys that ends up either caught on camera or arrested for, you know, urinating in the woods. Okay, so, you know, the key with this condition is that BPH affects the quality of life, and you don't have to live this way because there's good treatment options for it. So when you come and see me or see your urologist, we'll do a good history and physical exam and figure out, you know, how much this is a bother to you. We'll also do some studies in the office, and they're very common for urology offices to do these studies. One is called a UroFlow, where you'll stand up and go to the bathroom in a machine that will measure your flow rate. Another one is an ultrasound of the bladder and an ultrasound of the prostate. And then a final one is a cystoscopy, where we use a lighted instrument to go up through the urethra into the bladder. So with that overview in mind, I want to talk about the different treatment options for an enlarged prostate. Okay, the first treatment option is watchful waiting. It's essentially, you know, understand that things like alcohol, caffeine, and spicy foods can cause you to urinate abnormally, frequently. You know, so generally we start out with behavior modification. The second step is that, you know, once we've addressed behavioral issues, generally we put people on medication. You know, a lot of guys that here, I'm sure, are on Flomax, also known as tamsulosin. It's a medication that will help to relax the prostate, to help you urinate better. But, you know, just so you know, if you look at that questionnaire, let's say you scored a 30 on that questionnaire, you know, how many points would you expect the Flomax to improve your urinary symptoms? You know, the answer is really not much. It's about 3 to 5 point improvement. So if you're a man with moderate to severe symptoms, you know, just taking the medication is not likely to be the answer for you. You're likely to still have symptoms. The downside to taking medications, I mean, 1, there's an expense. 2, it's something you got to take every day. 3, you know, these medications can cause sexual side effects like, you know, retrograde ejaculation, meaning when you have an orgasm, you don't get an ejaculate, nothing shoots out. You can also get dizziness or fatigue, okay? And so, you know, a lot of men that try it, either they don't find that it's very effective, or they find that they have side effects that just aren't appealing to them. So herein comes what's called the prostatic urethral lift or UroLift. And of course, you know, we have handouts on each one of these procedures, you know, on your table. But how the prostatic urethral lift works is that you know, the prostate is a very compressible organ, and the way it works is it's an office procedure. We put a scope in through the urethra, we press on the prostate, and then we fire a suture with 2 anchors on it that hold it in the compressed state. And you can see, you know, there's no tissue destruction, there's no tissue removal, but essentially all we're doing is pressing the sides of the prostate together, much like you open up a sash on a curtain, okay? Aside from the UroLift, there are other in-office procedures that are heat-based or steam-based, of which, you know, microwave is one of them, Resume is another one. You know, the issue with these is that, you know, generally they're fairly uncomfortable. You get quite a bit of irritative symptoms afterwards, and these can cause sexual side effects. How do they work? They use a scope and then some form of energy to destroy tissue. The final option for BPH is minimally invasive surgery. These are procedures that are done in the hospital with a general anesthetic. These procedures include a TURP. You know, it's like that's a procedure your grandfather had, where you had a TURP with a little resection that you'd go in through the urethra and remove parts of prostate tissue. Another one is a newer one is called a green light laser. Similar idea, you go in with a scope and you use the laser to vaporize prostate tissue. And then finally a third one, which is one that I specialize in, called the holmium laser enucleation of the prostate, which I feel is superior to either one of those minimally invasive surgery options. You know, really the advantages of the minimally invasive surgery is that it is the most effective way to treat the urinary symptoms. But the downside is, you know, these procedures have sexual side effects. You know, you will have retrograde ejaculation after this. Another one is that they're an office procedure. So, I mean, they're not an office procedure, they're done in the hospital. So you have to have a general anesthetic. There's some risk with that. You'll have a catheter in overnight. There's a small risk for incontinence, which is leakage of urine. There's a small risk for having a urethral stricture, which when you look at the urethral lift, is that the prostatic urethral lift, which is done in the office, really has no sexual side effects at all. And it's a 10 or 15 minute procedure, and most people don't have a catheter. You walk in, you get the procedure, and you go home the same day. You back to normal activities within a week, okay? And you compare it to the minimally invasive surgery. You know, if you have a minimally invasive surgery, you're looking at taking it easy for a good 4 to 6 weeks afterwards, okay? So I want to talk a little bit about the HoLEP for BPH. You know, I talked about before how traditional therapies like a green light or a TURP use a loop or some kind of energy to vaporize tissue. The way the HoLEP works is it's like shelling out an orange. We use the tip of the scope to enucleate each part of the prostate, push it in the bladder, and then subsequently remove the tissue. So you can see the ultrasound on the left, maybe kind of faint. The tissue's intact, and on the right, we shell out the tissue, leaves the dark spot where there's water. You know, like any other condition, you know, if you have what's called a lipoma of your back, a little fatty tumor, the idea is that you want to remove it all. You don't want to leave anything behind. Same thing if you have a kidney tumor. You don't leave part of the kidney tumor behind, you remove it. And that's what the HoLEP does. So why do a HoLEP? Well, worldwide, there's high quality evidence that supports it's really the new gold standard in treatment. Compared with other techniques to treat BPH, it's the most durable of procedures. The reoperation rate is less than 1% a year. You have the best relief for bladder outlet obstruction. So if you had a catheter and had the HoLEP procedure, there's a 99% chance you'll be out, done with the catheter, and it's durable for at least 5 years, maybe longer. So HoLEP really has better outcomes for urinary retention. You know, if you compare it with the old-time TURP, you know, it doesn't even compare. Most people that have a HoLEP go home the same day versus an overnight stay with a TURP. It's independent of prostate size, meaning that a HoLEP can treat any size prostate and even can be offered on men on anticoagulation. So if you're on Coumadin, this may be a good approach. How does it compare with the green light? Well, you know, the problem with the green light is that generally the green light works for very small prostates and not great for moderate to big size prostates, whereas the HoLEP is, shows it's good for a prostate of any size. HoLEP is also shown to be more durable and more successful for treating urinary retention. So what next? If you're a man and you've got urinary symptoms, it's important that you get your urinary tract checked and see a good qualified urologist.